Hi, I'm Casey and I'm doing my informative speech about strokes. And for those of you that did not know, a stroke is damage in a blood vessel going towards the brain, and it blocks off all oxygen, all nutrients to that part of the brain. It can cause permanent brain damage and also cause the brain to stop working completely. Usually when we hear that someone has had a stroke, we automatically think of an old person or someone with bad health. But what's surprising that anyone at any age can have a stroke. If I were to ask you which age group had the most strokes, what would you say? Well, according to Centers for Disease Control and Prevention, 37% of people hospitalized with strokes were between the ages 15 to 44 years old. Although adolescents have the highest rate, that is not the only age group to have strokes. Strokes can happen to infants as well as the elderly. And my first section here is going to be about the strokes in infants. And according to American Stroke Association, the risk of having a stroke is greater during the first year of life and can also happen in 1 every 4,000 live births. 50 to 80% of children who survived will have permanent neurological defects, usually hemispheres or hemiplegia, which is total or partial paralysis on one side of the body, which therefore if someone has a stroke, either the right side or the left side will stop working completely. A stroke occurring around birth can also cause cognitive and sensory impairments, speech or communication disorders, visual disturbances, poor attention, behavioral problems, and poor quality of life. A stroke risk factors for children are much different than those for adults, according to the National Stroke Association. Most children presented with a stroke had a previous identified risk factor, most commonly sickle cell disease and congenital or acquired heart disease. Head and neck infections, head trauma, dehydration, maternal preeclampsia are just some of the risk factors for the strokes in children. Arterial ischemic stroke, which is also called AIS, is where there is a clot in the artery in the brain. With this type of stroke, the clot causes all types of blood flow to a certain part of the brain to stop completely. As a result, to no blood flow, a certain part of the brain will be damaged. Although the damaged part of the brain can never be used again, as the infant grows older and learns new material, the brain will compensate to the other side. Therefore, if you were to see an infant 20 years later and you knew if they had a stroke, you would never be able to tell any brain damage was there. And my second section is going to be strokes in adolescents. According to the Lifeline screening, young adults ages 15 to 44 were thought to be accounted for 5 to 10% of all strokes. But a report from the U.S. Centers for Disease Control and Prevention implies that this percentage is increasing. 1 in 3 of the stroke patients that had an ischemic stroke aged from 15 to 34 years of age had high blood pressure, and did more than half of the patients that were aged from 35 to 44 years old. Smoking is the most important risk factor for stroke and causes more young adults to have strokes than the elderly. Other major risk factors that cause strokes include heavy alcohol consumption, use of illegal drugs such as cocaine and heroin, and legal drugs like caffeine and weight loss products. Strokes can start off as something small, but they can lead to something that can be a drastic result. Even though it's rare, strokes in young adults are on the rise. In a study, Harsha Virginia, a 23-year-old, a perfectly healthy medical student, was having terrible headaches. After seeing numerous doctors who diagnosed her with migraines, but later she began to feel dizzy, vomiting, and no control over her voice. After becoming conscious, Harsha had a debilitating stroke at the base of her brain. And that is a true story. It just kind of tells you how drastic something can be. and it can lead to something that could change your life forever. And my third section here is strokes in elderly people. And according to the Department for Work and Pensions, as a person gets older, they are at a higher risk to have a stroke. People the ages 60 and over make up about 2/3 of every stroke victim. Elderly people who have suffered from strokes or transient ischemic attacks, which is also called TIA, are at a higher risk to have a stroke. Diffuse a small vessel disease is common in adults over the age of 70. As multiple small strokes occur, there is a gradual and insidious deterioration rather than a dramatic change, which causes a problem with speech or vascular dementia. And in a journal article called Stroke in 85 Years Old by Martin Leboutre, as a person gets older, they are at a higher risk for strokes and dementia. Dementia is common after strokes, but however, the relation is pretty complex. If someone has a stroke, they're at a higher risk for dementia. If someone has dementia, they're at a higher risk for stroke. The risk factors for stroke is old age, male sex, cardiovascular disease, hypertension, diabetes, hypercholesterolemia, alcohol, and smoking. They are still not clear on whether these risk factors are important in the old as they are important in the younger group. According to a journal article by Kathleen M. Michaels, stroke is the third leading cause for death, and the most important risk factor is age. Therefore, the elderly is at a higher risk to have a stroke. For every 10 years after the age 55, a person is at a higher risk for a stroke. Stroke rates are 1.25 times greater in men, but only because women have a tendency to live longer than men. More women than men die of stroke every year. By recognizing these risk factors, it shows that people who engage these issues have a tendency to reduce the stroke from happening. Make sure you do your research. Thank you for listening.